And that's the thing about shame. It makes people hide in their own little corners thinking they're so alone and
Mm,
they feel isolated. And
right.
that's when depression comes and anxiety comes and all of these big and sometimes damaging feelings that then
Yeah.
make us so disconnected from the community that is right there, but we just feel like somehow we can't reach them.
Well, hello there, and welcome to this episode of The Terry Cole Show. I'm super excited to introduce you to my new pal, Dr. Jessica Zucker, who I interviewed. She's a Los Angeles-based psychologist specializing in reproductive health and the author of the award-winning book, I Had a Miscarriage, a memoir, a movement. Jessica's the creator of the #1 viral hashtag, I Had a Miscarriage, campaign. Her writing has appeared in the New York Times, the Washington Post, New York Magazine, Vogue, Harvard Business Review, among many other places. She's been featured on NPR, The Today Show, and Good Morning America, and earned advanced degrees from New York University and Harvard University. So she is a smarty pants. But her newest book is what we were talking about. We talked about her first book as well. But her newest book is really compelling. It's called Normalize It, Upending the Silence, Stigma, and Shame That Shape Women's Lives, which is really something. It just came out 2 days ago. And we just talked all about all of the things that we are indoctrinated. It's like a cult of shame that women are sort of indoctrinated into, from getting your period to having a miscarriage to going into perimenopause or menopause. So many things. I hope that you enjoy this interview with Dr. Jessica Zucker as much as I enjoyed interviewing her. All right, I'm super excited to welcome Dr. Jessica Zucker to the Terry Cole Show. Dr. Jessica Zucker, welcome.
Thank you so much for having me.
I'm super excited. I think I'm trying to remember how I got turned on to your work, but it's in one respect, it's right up my alley, talking about all the things that we don't talk about as women and that we're not supposed to talk about, supposedly. And listen, life is changing, but I so appreciate just the idea. So you have a new book that just came out 2 days ago called Normalize It, Upending the Silence, Stigma, and Shame That Shapes Women's Lives. There it is. I love it. So I want to talk a little bit before we get into the book or the why of this. I really want to sort of come at it from, let's just say you were a Marvel movie character. Like, we all have these origin stories because we all do what we do for reasons. So what would your Marvel origin story be?
So I'm a Los Angeles-based psychologist, and I specialize in women's reproductive and maternal mental health and have done so for about 15 years at this point. Most people assume, and understandably so, that perhaps I specialized in this because of something specific that I had lived through that related to the topic, as
Mhm.
many therapists do, specialize in stuff that they've walked
Sure.
through. I have a background in public health, and I worked in international women's health, women's
Mhm.
rights for several years before pursuing my PhD. And my vision for my clinical practice was to somehow marry my background in public health with the clinical work. Up until that point, my passion really came from simply being a woman myself, being a woman living in this culture, uh, telling us what to do, what not to do, how to act, how not to act, all the shoulds that we come up against. But I had not lived through anything in particular that had really sort of shaped the way that I was thinking about my career path
Mhm.
until it did.
Mhm.
So 16 weeks into my second pregnancy, I had a miscarriage while I was home by myself. And suffice it to say that, of course, upended my professional trajectory, my personal life. It impacted me in such a deep and profound way. All the while, though, for 10 years or something, I had been sitting with women hearing these stories of grief, of loss, of shame, of silence, of stigma, of alienation, of self-blame. And until I was actually in their shoes, I related to them empathically, of course. I had read all the books. I had gone to all the trainings. I had, been in consultation groups. Nothing could have prepared me for this type of understanding.
Yeah.
Yeah.
Like the lived experience is so different. So how did you move through that grief? Like, how did you actually do it?
I mean, it's a good question because in my first book, I talk a lot about not knowing. Like, despite all of my academic, accolades and the support around me, I was stymied. Like, I did not know what to do for myself. It was sort of like,
Mhm.
do you take a month off or do you go back to work? Like, if I go back to work, I'm focused on the people that I adore and want to help. I also then hopefully stave off their own worry about me and
Hmm.
situation. If I stay home, am I going to think about it more, feel it even more?
Right.
Is that healthy? Is it not? Like, I did not know.
Hmm.
It was so interesting to, be a psychologist, have a PhD,
Right.
and be so lost.
Mm.
It was an opportunity, honestly. I mean, I didn't see it as such at the time because I was in
Yeah.
such pain. But in my first book, I do talk about how I did go back to work like a handful of days later. And do I regret it? I don't. I think that having the focus of and the passion of my work in front of me was a nice reprieve, a welcome reprieve from the grief. But then the minute I got back into my car to head home, I was overwrought with like, how is this my life?
Mm.
How did this happen? And how is my story this dramatic, so traumatic? Like, how do I process this in a way that can help my patients ultimately?
Right.
I mentioned that I lost the baby while I was home by myself, but then because I was home alone, my husband was racing home to be with me, but I did not feel safe or comfortable calling 911. I didn't want like random men
Yeah.
running through my house to
Hmm.
help me when I had a baby between my legs, a fetus between
Yeah.
my legs. So my doctor walked me through what to do by phone. So
Mm.
I had to cut the umbilical cord myself,
Wow.
promptly began to hemorrhage.
Sure.
We brought the fetus in a bag to my doctor's office, and then I had to undergo an unmedicated DNC. So it was like
Mm.
the trauma was so elongated.
Hmm.
It was unlike anything I had ever heard. Like, I didn't know that things could unfold like this. It felt like I was in like some sort of documentary. I was scared that I might lose my life that day. So
Sure.
so all of the things, it's I was already a mother, so I also felt like I needed to quote unquote keep it together on some level for
Yeah.
him.
Yeah.
Um so when you ask how, I got through it, I think that the best answer is like I fumbled my way through for a while. And then I found the page. Like, I had always loved writing and loved writing my dissertation even, and I started sort of writing ad nauseum for every outlet about various aspects of miscarriage, pregnancy loss, stillbirth, life after loss, sex after loss, relationships after loss, like
Right.
every iteration of the topic.
And the book, for those who are wondering, is called I Had a Miscarriage, a Memoir, a Movement
Right.
by Dr. Jessica Zucker, and that came out in 2021,
Yes. Thank
but
you.
available still.
It is available still, and it seems like it wasn't that long ago, and yet my loss was 12 years ago at this point. So,
Mm. Yeah. So let's fast forward a little bit. This is great, but moving into what inspired you to write the book that just came out 2 days ago. So when you think about your inspiration,
Yes.
Normalize It is the name of the book. And it's, the subtitle is Upending the Silence, Stigma, and Shame That Shape Women's Lives. And it's funny, Jess, when I read the subtitle, it just like, I can't even explain how I felt physically, but it was like, boom, resonated so hardcore.
Yeah.
Because it does shape our lives. It has shaped our lives. And even those of us who've had a lot of therapy and those of us who are very vocal, it has still shaped our lives because you have to deal with the shame of the things you're not hiding if you become someone who doesn't. So tell me a little bit about the germination of this book and the trajectory of this book. Why this book? Why now?
Normalize It felt like a beautiful, important, and profound expansion of all that I've focused on throughout my career and my life.
Mm-hmm.
And we can't have this anymore. The cultural silence that then leads to the stigma, that then results in the shame. It's this swirling trifecta, and it's antiquated.
Yep.
And so I feel like this book is a call to action, but it's a compassionate one. It's not saying that everybody has to take out their bullhorn and share their stories on Instagram or with the entire universe. You don't. In fact, I have some examples in this book of people just whispering to a neighbor or sharing with their best friend, or of course, sharing in the context of therapy, and how not being silent and shedding that stigma and moving away from that shame allows us to experience such a deep sense of vulnerability and ultimately connection.
There's something really powerful, though, about naming the shame, because I think that there's all these misrepresentations of why, of the reasons to not talk about things that people consider private or too much or whatever it is. And the shame, as, Brené Brown talks quite a bit about, what are the conditions that allow shame to grow? And secrecy, of course, and silence, of course, are the two biggest ones. And so I love the idea of having it be an invitation, a gentle invitation, to not breed this shame in our lives. And it's, in a way, you're going first, right? by sharing yours. And you did go first by sharing your story about the miscarriage and by having a whole movement. In a way, it's such an underrepresented experience because it's such a huge experience. And so, 1 in 4, I don't even know the stats, but I know that it's at least that.
Yep, it is.
Right. And so the invitation to go, this is a big deal. This is harmful. This is hurtful. This is a major loss in what happens to your life. And obviously you've written extensively about this. But with the Normalize It, how are you, and let's talk a little bit about the book. In what ways are you inviting people to normalize it? And with whom is the book stories of other people sharing, stories of you sharing, ways that we can share?
I see. Yeah, great question. Okay. Yeah, so the book basically takes on everything from girlhood through menopause and all that's in between. And it's not because menopause is end of life, but I'm trying to take on all of the potential milestones that girls and women navigate that we still have difficulty integrating into everyday language and sort of huddling in together and saying, welcome to the club. Instead, it's like, oh, I don't want to be here. Like, I'm too uncomfortable. I'm embarrassed. I am ashamed. I'm a failure. So in the book, we start with girlhood. Why? Because that is essentially where Dr. Carol Gilligan, who's this, forerunner psychologist in the field, she talks about girls don't lose their voice. They have a voice. They don't need to find a voice. They already have an established voice. They are taught through culture, being at school, being in the world, being, seeing things on TV and the media, whatever, to quiet it.
Mm-hmm.
And so I wanted to start there because it's like, oh, wow, how does that then feed into as we get a little bit older? Body image, right? So it's girlhood, menstruation,
Mm-hmm.
how are girls talked to or not talked to about menstruation, all the shame, all the silence around that, how
Yeah.
they come to think of themselves somehow as maybe dirty, quote unquote, or
Mm-hmm.
weird or different. And girls, the research finds that girls are actually sort of like hiding their symptoms because they feel ashamed of them.
Mm-hmm.
And so we go from menstruation, puberty to body image to eating disorders. And then the
Mm-hmm.
book also takes on friendships, and how we don't even talk enough about that. How there are changes in our friendships over time for various reasons,
Mm-hmm.
and how even that is sort of stigmatized and we're sort of hush hush about that. Divorce, motherhood,
Mm-hmm.
deciding not to become a mother. Obviously, pregnancy loss is included in this book. And then
Mm-hmm.
the idea of menopause. It's somehow don't, we don't educate girls and women that they will all eventually get
Mm-hmm.
to a place of menopause.
Mm-hmm.
And so you asked what kinds of stories are threaded through. So I use sort of fictitious patient stories in each chapter to
Yeah.
anchor it and to illustrate what things feel like and look like in the therapy room,
Mm-hmm.
and how people are opting to share and sometimes not to share their stories, and sort of how that
Mm-hmm.
works out. So it's not like every example ends with some sort of like, ooh, and they found their ultimate freedom. Of course not, because sometimes we do share our deepest truths and we're not met with loving kindness and we're not met
Right.
with open arms. And so I wanted to kind of show the entire spectrum.
I think we're seeing this movement now, and I've been a part of this for years because I started perimenopause at probably my mid 40s, like with insomnia and stuff like that. And then, had full blown menopause as I went through it because I'm 60 now. I talked about it, and it's funny, I was talking about it publicly because I needed help because I was like, what is going on? Why is sex suddenly painful? Like, it was shocking to me.
Yes.
And then I was like, I'm just going to interview experts on my podcast and I'm going to find out. And that's literally how I found a place and how I got on hormone replacement therapy and how I started getting really educated. And this was years ago. And
Mm.
now one of my friends, Tamsin Fidel, has a
Yeah.
book coming out, How to Menopause,
Yes.
and Naomi Watts' book, which is right
Yes.
over there, Dare I Say
Exactly.
It. And there's something so beautiful and sort of speaks to what your book is really about that's happening, at least in the spaces around perimenopause and menopause, because you have all of these women coming of this age at the same time who do have voices and who are using them. So to
Yeah.
me, it feels very, I don't know, it's exciting to have people talking about it and
Yeah.
getting rid of that shame.
Right. And these are powerful women who have had careers and know what they're talking about. And culture tells us that we become irrelevant. I don't know. In LA, it's probably in our 40s, but it's
Hmm.
definitely everywhere else, it's at least 50s onward. And
Yeah,
so for these amazing women to be writing books on the topic, I think is so helpful and so powerful. And my hope is that it gets into the hands of younger women so that they know what's
yeah,
coming.
absolutely. I also think that there's something really powerful about declaring, like for me, this whole becoming invisible thing, like not a chance. Like, no, I am fully rejecting, I am fully claiming my visibility and my right to be visible from now until the end of my life.
I
Like,
love
no,
that.
because we have to do it. Like, we have to decide. I feel like there's another thing we don't talk about, and maybe you do in the book, and let's find out, is about the aging process. And sort of what is the expectation, as you said, depending on where you live? Maybe there's different, but the truth is That's pretty much the same across the board, right? Where you're going to get into your 50s and you're going to be not valuable, not seen as vital in some way.
Or sexy or sexual or
Oh, yeah.
any of that.
Yeah. All of the things. And so for me, I made a decision when I started really seeing changes in my face, you know what I mean? Where I was like, okay, what am I doing? So am I doing it? Am I going to do it naturally? We'll see. I don't judge anyone for doing anything. Like, do whatever makes you feel good. I am not judged. I'm not the,
Yeah.
I'm not the police when it comes to this. But I had about 5 years where I really, in therapy, talked about it with my husband. Like, would I do what I want to? Talking to my sister, we used to always kid around about it. My sister and I, like, start saving your pennies because you're going to need a neck lift, and you know what I mean, like that, you know.
Right.
And then I came to this really kind of profound realization that I would take time, energy, money, and instead of putting it into altering myself in some kind of a different way, I would put it into radical celebration, radical acceptance of this is 60.
I'm
That's
obsessed.
it.
I'm obsessed. So what does that look like for you? Tell me about this. I love it. I want to join the
Jumping up.
movement.
Please do. Jumping on my trampoline every day. I have a mini trampoline. That's my workout. Hiking with my dog and my husband. I got chickens. I have geese. It means spending time with my girlfriends. I have the same friends since Nixon was in office. So it means going away with my same 7 friends I've had all of my life. And I collect women. I love women. So I have many other friends too. But carving out time
Mhm.
to do things that inspire me. You know, I'm writing my next book right now. So, you know, there's a certain amount of grinding when you're writing books,
Yes.
but also joy and
Mhm.
also meditate. I meditate every day. Like, part of it is, I think, rejecting the narrative
Yeah.
because I'm not letting anyone else determine
No.
my value. I literally me, only me.
Yes.
I know my value and I've got something to say and it's valuable and I'm an expert at what I do and that's valuable. And also I don't need a 40-year-old man's gaze telling me my value.
No.
Like, and society in respect to that
Yeah.
too. Like,
Exactly.
absolutely not. So I also follow women who are inspiring me in a similar way, whether it's Isabella Rossellini, whether it's Jamie Lee Curtis, there's all of these, Andy McDowell,
Yeah.
lovely women doing it their own way. And again, this is not to shame anyone. If you had a facelift,
Right.
go you.
Right.
There's literally no judgment, I swear to
So
God. I just
interesting.
had to decide. Yeah.
But it's like men wouldn't be talking about this, you know? And that's the
No.
interesting thing. I think that like, you know, you're mentioning these women who are embracing aging, which is just a natural process. And we're looking up to them because we're like, oh, because everybody else is doing something to try to look like an earlier version of themselves.
Yeah.
But
But the
I don't
shame,
and I don't see men talking about this. And yeah,
no.
the shame of no longer being the object, you know,
Mm,
objectified and the object of, you know, ogling,
hmm.
is an interesting transition. And I think it would be helpful if we were taught to, as it seems like you're doing, you know, celebrating that, integrating that,
Hmm.
wrestling with it. You know, I mean,
Sure.
it is a lot to go through these transitions. It is a lot. Um,
Absolutely.
yeah, I mean, to go from, you know, being fertile or having, you know, one's period to not, it's like, wow,
Hmm.
okay, I am not the spring chicken anymore. But what does that mean? And, you know, and where else can we find meaning? You know, it's like our culture places so much value on the externalization of so many
Hmm.
things and that, you know, our beauty and the attention that we get, the validation that we get
Hmm.
through other people. What about inside? And I mean, sounds like
Yes.
you're doing exactly that, which is so inspiring.
Why, thanks, Jess. But part of it too is I used to be a talent agent for supermodels and celebrities before I became a therapist.
Oh, I
And I
didn't know
remember,
it. Yeah.
yes, this is just a whole different career. And I remember someone saying to me, more than one person being like, oh my God, how do you, doesn't it make you feel so insecure to represent supermodels? And I was always like, no, because I'm not a supermodel. Like,
Also, because I'm beautiful too. Like, why does it have to
yeah,
be the compare and the contrast, which
yes.
I find so fascinating? It's like even when it comes to pregnancy loss, it's like people are
Mm,
comparing and contrasting. Am I allowed to feel badly about a 6-week loss versus a 16-week
yes.
loss versus a 26-week loss? Like,
Jesus.
how is it that we have come up with these hierarchies of pain or shame or
Hmm.
disappointment when you yourself are beautiful, when somebody's 6-week loss that's important to them because it's their lives?
Yes. Yes. So forget compare and despair. This is part of the message of what you're talking about and what we're talking about. And focus sort of your eyes on your own paper. And
Yeah.
I think that this book really is an invitation. What happened for me in doing the research about the book and about you is I started really looking into different corners of,
Mm.
is there parts of my life where I am holding shame? Like, is there stories that I'm not telling because of shame? Are there things that I'm repressing? And, I found a few things and I did some journaling about it. So I do feel like you guys listening, if you feel like you're hiding, if there's a part of you that really feels identified with what we're talking about, with feeling less than because of something,
Yes.
that the power that it has on you, you're giving it more power by staying silent,
Hmm.
right?
Yeah, it's like if you feel less than or if you feel too much, there's a lot of that
Mm,
as well, that women are made to feel like too much in a variety of situations. And I think whatever it is that lives inside of you is important. And
mhm.
again, it doesn't have to be, that you get on a TED Talk stage and share
Right.
the entire globe. But it's more about, like you're saying, like acknowledging it for yourself. Like
Yep.
journaling about it, I think is a perfect example of
Mhm.
just putting it out there, no longer caging it within yourself.
Mm,
And you can decide later, oh, do I want to share this with a friend? Do I want to throw it away? Do I want to, have a party about it? Whatever it is, at least it's been acknowledged.
yes. And when we move that up and out, that's why a lot of times I'll have therapy clients like write letters to people, even if they're dead, right? Even if people are not here. I'm like, but if you still have something to say, then it's a valuable exercise to say it. And then you could read it out loud to a friend. You could then burn it. Like there's, lots of
Exactly.
choices of ritualistic things that we can do.
Yes.
But I love the idea of us being proactive as you're sharing with us in this book about not letting it morph into shame. Like doing something before, recognizing that
Exactly.
we're all in the same boat.
I know. And that's the thing about shame. It makes people hide in their own little corners thinking they're so alone and
Mm,
they feel isolated. And
right.
that's when depression comes and anxiety comes and all of these big and sometimes damaging feelings that then
Yeah.
make us so disconnected from the community that is right there, but we just feel like somehow we can't reach them.
Yeah. It's interesting. It's like part of the way that you're leading in this space is by sharing. So the modeled behavior that especially the first book and this book as well, it gives us permission. And I feel like there's something so powerful about you owning your own story and sharing it
Uh,
gives other people permission to share their story. And we need that in leadership because it's one thing to say, this is what you need to do. But what you're doing is you are doing it. You are actually modeling the behavior, allowing yourself to be vulnerable, sharing your tender parts
mm,
with us. And there's something really moving about that. And I think that I imagine from both books that what are you hearing from people in the world?
Yeah. I mean, it's interesting. I felt like with my first article for the New York Times, like that's exactly how I envisioned it, what you said, modeling.
Hmm.
But I also knew it was a professional risk potentially.
Yep. Yeah.
I thought, oh, what about, prior patients of mine, if they come across it, are they going to be scared? Or current patients that come across it, are they going to feel no longer safe in my presence? Or again, like
Yep.
nervous that something that happened to me could happen
Mm.
to them. And, I did this sort of calculating of the risk and I decided it was worth it
Mm.
because I hoped that if enough people around the world saw this, hashtag I had a miscarriage sign,
Yeah.
and I was inviting them to come out of the woodwork and share their story. Again, not on a
Mm.
stage necessarily, but just even with themselves, if they had
Right.
suppressed it or pushed it down. My hope was that we would see a true cultural change
Mm.
where people would no longer whisper, I had a miscarriage, or that we
Yeah.
wouldn't have to learn about it only after we had our own, that it was
Right.
something that we could talk about as if we were talking about what we were going to have for dinner that night.
Yeah.
So just to integrate it because it's a normative outcome of pregnancy. And so
Hmm.
why is this something we're not talking about
Yeah.
openly? So 2 weeks after my first book came out, I was diagnosed with breast cancer.
Mm.
And I took some time to really, of course, process how intense, how scary. My kids were young. It brought up a lot of concern and fear for me.
Sure.
Would they be motherless? Would I lose my life? How
Hmm.
could this happen to me? Just all of the concerns. And I decided to be open about it on Instagram. Because I
Hmm.
felt like, especially at that time, I felt like my community was so invested in my miscarriage content that I felt
Yeah.
like I can't just kind of now abandon them and not say anything. And I wanted to
Right.
kind of invite them into this next trauma of my life. And so what's interesting though is I do include breast cancer in Normalize It.
Hmm.
And I try to be as vulnerable as I can in terms of deciding. I have myself in the book sitting with a patient who's been diagnosed and she's gone through surgery and she's talking about all of her body shame and
Hmm.
her fear of sexual intimacy with her partner because of it,
Hmm.
all of the psychological elements of
Hmm.
breast cancer that she was navigating. And so I write in the book a bit about my experience
Hmm.
and how I decide, though, in that moment, not to share with this patient. And because, as you know, as a therapist, sometimes us sharing can be incredibly productive and so helpful in healing.
Yep.
And other times, especially in this
Mm.
case, my concern was that she would be then worried about my mortality
Yep.
and my process and which
Hmm.
surgeries I had and which radiation or did I have chemo.
Yep.
Like I did not want her to have to be thinking about me instead of herself.
Right. I feel like with the vulnerability piece and therapeutically, it's funny. I had a teacher at NYU when I was getting my master's to become a therapist because I was always on the fence about what or when would I ever divulge anything about myself therapeutically. And I asked this teacher who I really respected, and I said, what would you tell a client? And he said, Honestly, I would tell them anything that I truly believed might help them heal." And I was like, "Bro, I think that's a good way to go. I think that's a good barometer." Um,
I love that.
so,
Not all therapists feel that way, though. Yeah.
oh, I know.
Yeah.
Oh, yeah. It depends on your school of thought. And
Yes.
I think that the mindfulness, as you said, sometimes we don't make the decision because we want to make sure we're not co-opting their treatment. And your clients rely on you and they care about you and they worry about you.
Yeah.
I don't want to need anything from my clients. Like we've all got our way of relating,
Right.
but it can be very powerful, as you were saying. I want to ask you a question that I ask people at the end of the interview because I'm still obsessed with boundaries. I just can't stop. So personally, what has been your most challenging boundary struggle and how did you overcome it if you have?
I need some time.
Well, what comes to your mind? Because something must have come to your mind.
Well, what comes to mind are the
Mm-hmm.
things that we're talking about. It's like the miscarriage and breast cancer. And I think that what we didn't get a chance to talk about is all the platitudes that often rush in
Mm.
a trauma like these. And I guess I still sort of wrestle with like, did I have strong enough boundaries in certain situations with people who
Mm.
said things to me that felt so off-putting and almost cruel?
Yep.
I knew they were well-intentioned. These are wonderful, loving people in my life, but nevertheless, what they said, the way they said it, when they
Mm.
said it, the timing of it, it just landed in a painful way.
Yep.
So I think I could do better at saying more clearly in a moment. But again, I mean, I think when you're going though through trauma, it's like very hard to find more words to explain what you're going through and how people should be caring for you. But even in the aftermath, I could circle back and say, when you said this,
Yeah.
it didn't feel great. I don't want to be called a warrior. I don't want to be at war with my body. I don't want to be seen as if I somehow don't survive this, that I didn't fight hard enough. You know,
Yeah.
all of this battle language surrounding breast
Mm-hmm.
cancer is a real problem for me.
Yep.
So, yeah, I feel like in my writing, I'm a bit sort of more brave when it comes to boundaries and trying to help other people know how to treat other people.
Yeah.
Um, but then in a moment when it happens for me directly, it can be a bit more challenging.
Oh, I so get it. You guys, the book is called Normalize It, Upending the Silence, Stigma, and Shame That Shape Women's Lives. The author is Dr. Jessica Zucker. It is out. It just came out 2 days ago. Go get it where all books, any fine books are sold. You can get this book. And Dr. Jessica Zucker, where can people find you?
I am on Instagram at I Had a Miscarriage, and my website is drjessicazucker.com.
Right on. We'll put all of that in the show notes. Thank you so much for being with us today. I appreciate you and your work.
Thank you so much for having me.